afternoon. It's really great that we've got some people online to hear more about our vacation internship program. So my name's Annette Tam, I'm a clinical academic professor of nursing, and I'm the lead for the North East North Cumbria Insight program. And I'm going to take you through just a couple of slides this afternoon about what Insights is, so you've got a bit of background about what we're up to and what we're doing in the first place. And then I'm going to hand over to my colleague, Professor Barry Hill, who's going to talk about the internship program itself. And then we've actually got some interns who want to give you their experience as well about their internship program with Insights, but also about interns in general, about why you'd want to do an internship, what it's given you, what the benefits are, and what it might lead on to. So hopefully that'd be a bit, interesting to listen to their kind of like stories and their views. And then we'll obviously open up for any kind of questions. Please, there's not many of us here at all today, so please just put any questions you've got into the chat. And we can answer as we go, or we can leave it till the end. That's fine as well. So, but welcome everyone. Next slide, please. So you'll have probably seen that the webinar is being recorded. We do have a website that all our Insights information goes on to, so it will be made available. So again, if you want to look back over it at another time, that's why we were doing it. Please keep your microphones on mute during the presentations, and just helps with feedback and with background noise. If you don't want to be seen, keep your camera switched off, and I obviously understand if you're in a public area, then you might not be able to do so. And yeah, just pop any questions you've got into the chat function. That'd be great. Next slide. So, as I said, what we'll briefly cover is why. So we'll be talking about the NIHR, and the NIHR is really the research arm of the NHS. And that's got a whole load of funding to it, but we'll explain about why the NIHR is trying to support people earlier on to be involved in research in their careers. We'll go with what, and that's our internship program we've got currently available, and this is the vacation internship, and Brian will go through the details of what that's about, and also talk about the timelines, about the application process and all that's about. And I said we've got some we've got Stephanie and Machine who will give you their experiences and then open up to any questions at the end of it. So that's just a quick overview of what will get covered in the next 55 minutes. Next slide, please. Okay, so you may or may not have heard of the NIHR, but also you might have not heard of the NIHR Academy. And really this is to do with training and development of staff, health, social care, both medical and non-medical staff across the whole of the kind of the pathway. And it's been fantastic that the NIHR Academy have been really supportive of trying to support training and development of individuals who've been more engaged in research. And back in April of 2023, they announced this whole new initiative of trying to provide more opportunities for individuals to get involved, because sometimes it's tricky to get the time, the money, or the resources to be involved, or to kind of like gain some of these skills that individuals need to kind of take them to the next steps. So really, this is really thanks to the NIHR Academy and the additional funding that came through as a part of this initiative. Next slide, please. So there are loads of funding opportunities, and it's really amazing when we have a think about the NIHR Academy, about what they have to offer, and they're offering support at all career stages. So certainly from those initial experiences you'll see on that left-hand side there with the red kind of like box around it, we've got internships. And there's currently a regional internship program. That's not this one, but that's also, again, of anybody of any kind of level within their career who just want to kind of get an introduction to research. So you could have been in clinical practice for a number of years, but never really thought about research, and thinking about an internship might be a nice start. But we've also got the Insights program, and that's what we're part of. That's what I lead on. And this is very much a regional based group of activities to engage and support people much earlier on in their careers, both students and early undergraduates within the first 5 years of registration. But the NIHR Academy is not just for those really early on. We've also got PhD opportunities, so pre-doctoral awards. They've got a whole range of opportunities in terms of master's opportunities, promoting research careers. We can also fund fully funded PhD opportunities, as well as postdoc opportunities can be funded both with the postdoctoral awards. They've got global health fellowships, and they've even got research professorial opportunities as well. To try and help you with those those awards, they've even got things like bridging and short-term support awards you can apply for, and there's a whole host of other organisations within the Northeast here that are linked into NIHR infrastructure. So all we're saying to you, this is part of a journey, and it's part of a bigger picture. But we're all linked together, and we're all here to support each other no matter what stage we are at within our research journey. But at the minute, we are looking at this in the red box, and we're the Insights programme. Next slide, please. So we're one of 12 Insight programs, and these are regional. So across the whole of the country, you'll find, some of these attached to whichever, region they are. And I said I'm the lead for the North East and North Cumbria Insight program. And the NIHR Academy invested over £30 million, a couple of years ago into these supporting, the training portfolio for health and social care professionals. And what the whole idea was to really showcase and attract students in registered healthcare, social work, and public health professions into really a whole range of research careers. And that could be clinical academia or it could be research delivery. And it's just giving people that opportunity much earlier on, because previously, for any kind of healthcare or social work individual, you would tend to kind of qualify, get into your profession, maybe stay in that profession for a number of years, and then maybe think about research. This is trying to engage much earlier on and realise really research potential much earlier. And that for me is really exciting as a clinical academic myself. And what we're trying to do is really embed a positive, inclusive research culture, trying to take away the research being a scary thing, or that only some people do, or only people in academia do. Actually, no, there's an awful lot of research that goes on that we should all have a role to play a part with. And you'll find that it's very much a part of 4 pillars of practice for people. So it's really important to understand what research is and how you can engage with it, but also how you might use research to support services, individuals, and improve care and outcomes. And I think, again, we can all have a role to play within that. And that's exciting. Next slide, please. So as I said, we cover the whole of the North East and North Cumbria. So you'll see there our map of the areas that we cover. And within that, we've partnered our Insight programme with 5 universities. So that's Northumbria, Newcastle, Teesside, Cumbria, and Sunderland. So anybody studying at any of those organisations, any of those universities are eligible for our funded opportunities within the Insights programmes here within the North East and North Cumbria. So welcome everybody. And yeah, so large geographical area and spread that we cover. Next slide, please. So our ambition for our programme was to inspire students in early career in health and social care residents to engage in research from the very start. And we're trying to deliver a whole range of programmes, and this internship kind of offer being just part of that. We also have fully funded masters opportunities that we'll kind of promote at the end of this kind of webinar. We've also got kind of introduction to research via something called the 4Ps Light program. We've also run a number of webinars and other opportunities to engage. And you'll see that, we're a really large, area that we cover, really diverse range of professions are engaged within our programs. It's really anybody other than a doctor or dentist can be involved in this. And there are over 50 programs of health and social care across our region with, 1,600 undergraduates. You can see we're trying to reach out to an awful lot of people there. But hopefully we are trying to stimulate and inspire individuals into research much earlier on in their careers. Next slide, please. Okay then, so I'm going to hand over to Barry. Barry, over to you.
Thanks, Annette. Hi, everybody. So I'm Professor Barry Hill. I work at Northumbria University, so it's good to see you today. We're just going to have an overview of the internship programme. So I think the internship programme has been really successful with some of the students that we've had so far. We've had really good feedback from them as well. And like Annette was saying, the whole purpose of the NIHR opportunity is to develop the skills and knowledge that you need to be a future researcher, whether you're interested in clinical research or just refining some of your graduate skills. There's real opportunity there. One of the key things with the internships is it's available to undergraduate students and also newly qualified or early career health professionals, and we will go through the list of the people that are eligible as we move through the slides as we go through these. But there's a whole host of activities that you'll undertake. But I think one of the key things is you've got time to enjoy a project, work with a mentor, and have a contribution whilst you're being paid as a research intern. So it's really good CV building and opportunities for future roles as well. Next slide, please. So the eligibility is here on the slide, but you can see typically students that are towards the end of their programme are eligible. And then we've also got the training towards one of the regulatory bodies along the side here. So we're really looking for, it's quite vast. It's open to most professions. And what we tend to do is we look through the applications as a group, and we try and be as fair as possible when we're selecting the students as well. So there's a nice range and mix of different types of profession. So you can see we've got the Academy for Healthcare Science, we've got the Chiropractic Council, dental, medical, all the way down, including the NMC, social work, and so on as well. Next slide, please. So if you're in training for one of the following professions, or you have qualified but you're early within your career, typically these are the professions that we are offering these opportunities to. So really anything that exists within the healthcare setting, acute sector, including social work, and all of the bits and bobs that go in between. And then we've got the areas where you can undertake your internship. So this is a North East and North Cumbria opportunity. So as long as you're within our region, you're eligible. But you can see we go all the way down to Cumberland here, County Durham, all the way up to Berwick-upon-Tweed, really, where Northumberland ends, and over to the lakes. So a really nice, big, large geographical space. Next slide, please. So what we're talking about here is the vacation internship. So this really relates to the timing within a standard academic program. Next slide, please. So what you'll be doing within these internships is you will be doing a project that you're interested in. So ideally you would come along and you'd propose something that you feel needs to be researched or looked into, or an area of research that you would like to refine with a mentor. So we've had, for example, students that have worked with their mentors at the university working on primary research projects, but we've also had opportunities for them to go into the clinical settings and work with the clinical research teams to build up some of their skills. So one of them had spent 2 or 3 days in the clinical area building up some clinical research skills. And then as a contribution to the internship, developed a poster, which is one of the outcomes for the project. So you do have to have an identified academic mentor. And these research vacation scholarships are 65 hours. They are funded, which is really great news. So you can see there your stipend's £925 for the 65 hours. And it's really all about your learning. And in return for the internship and the refinement, you'll have an opportunity to do a poster and to feedback at the end of the opportunity. Next slide, please. So in terms of your supervisor mentor, they have to be appropriate. They would be part of the same profession that you're training within, but you have to have an agreement, really. They have to be in part of the process, part of the discussions before you apply. So everything's kind of pre-arranged prior to your application. And ideally, if you are working within the hospital or the primary care sector, having conversations maybe around some gaps, some clinical gaps that you could potentially do some scoping reviews on, or have a look through the literature to see how you might be able to find a solution. That might be a good first step. And then go to a mentor or supervisor that you think would be helpful. If you're not too sure, there are research development teams within the organisations, and you can also go to your line managers or leaders and ask for some signposting, or you can ask us. So if you've got a particular area of interest, we'll be able to support you through that as well. Next slide, please. So what's expected from you? So we do expect a contribution in turn. So we would like you to come along to the meetings, engage with your mentor and so on. But I think one of the key things for us is enjoying your journey. So if you are doing your research, that maybe, for example, you can help us contribute to our website. We can get some photographs, we can get some small videos if you're interested, there's no pressure, but things around your experience and your contribution through the NIHR process of internships, that would be really, really helpful. But really we want you to enjoy it, work with your mentor, and learn some research skills along your journey. That's the key premise of our expectation, that you have a good time and you're learning about clinical research. That's the key thing. Next slide, please. So you can see that we've got the key dates here. So the vacation internship timelines, applications open this January, And then obviously we have our webinar today, and then the applications close on the 15th of February, and we'll try and communicate these decisions to you on the 20th of March. So that's for the vacation internships. And then we have the term time internships, where we'll be opening these in March on the 2nd, closing on the 12th of April, and communicating these out in May, June time. Yeah, May, sorry, 22nd of May. Next slide, please. We have got some information here for you. So if you've got any queries around internships specifically, please do get in touch. My name's there, Barry Hill. We can go through it, but the key thing is, I suppose the key information is these are very flexible. You get 65 hours, you can use them and you can fit them in and around your usual work. So we had a few students that would contribute, you know, a few hours here and a few hours there. Some might be able to do it full time. It really does. We do have flexibility, but as long as you do complete the 65 hours within a given time frame and it's agreed, then that's absolutely fine. And you can see there's representation across the universities as well. So there's Northumbria, Newcastle, Teesside, Sunderland, and Cumbria. Should you like to get in touch with us as a team. Next slide, please. Okay, and I'll hand over.
A registered mental health nurse. I qualified back in September. Good afternoon. My name is Roisin El-Fatahi and I am a registered mental health nurse. I qualified back in September 2025 at Teesside University, and I'm currently enrolled on the Masters in Clinical Research degree. Again, I'm at Teesside, and that's where I'm at the moment. I'm actually in a lecture on data management in clinical research, so I'm sorry that I can't be with you today. I'm here to talk to you about the vacation internship that I completed last summer. August, September time I completed it. It was over 3 weeks and I completed around 65 hours during that time. My initial interest in research started at the end of first year of my nursing degree, and I've been discussing research with my personal tutor, Dr. Mark Seward, during that time, and we both had an interest in military and veterans research. And it was during the application for the NIHR funding for my Masters, I decided early on that I wanted to do a Masters in Clinical Research, and when I was doing the funding for the NIHR, it was brought to my attention that there was the potential for me to do a 3-week internship over the summer. So Mark and one of the principal lecturers had a conversation and they agreed that I could do it, as I was up to date with all of my placement hours and my assignments. So the aim of the research that we completed, and we're still working on at the moment, is NHS staff's awareness of veterans' mental health in the Tees Valley. We looked at research methods and designs. We decided on a qualitative approach to the study. So we were going to conduct one-to-one interviews in the future. And I helped with creating the research questions for the interviews. I designed a research recruitment poster, which I really enjoyed. I like that creative side of it. I also worked on the participant information sheet and the consent form. One of the more challenging parts of it was the ethics application, but that has been so valuable to me because I'm just about to do my own ethics application for my master's dissertation, so it's come in so useful that I went through that process. Everything that I did during the 3 weeks has come in useful for my master's. I'm using everything that I learned, everything, probably on a daily basis. And I know that I'm going to continue to use it in the future. I'm continuing to work on veterans research for my master's, and I hope to do a PhD next, and there's a good chance that that's going to be to do with the military and veterans too. The internship was an amazing experience. It was an amazing opportunity, and I would recommend it to anyone even remotely interested in any type of research. It's really beneficial. I can't emphasize that enough. I really can't. So that's it from me. I wish you all the best of luck, especially to those that are applying for the internships this year, and I hope you enjoy it half as much as I did. Thank you.
Apologies, I shared really quickly there.
No
We've
problem.
got tunnel vision.
So thanks. That was Rasheen. As you see, it's kind of like leapfrogged her on then to do a master's, and then she's even thinking about PhD already. So she's got that kind of that journey, and she's obviously got an area of interest that she's got around the veterans, which is great to hear about. And now we're going to pass over to Stephanie. So Stephanie, would you like to share, please, and give us your experience?
Sorry, I was talking to myself. I'm on mute. Is that visible?
Yeah, we can see that fine.
Yeah,
Thanks.
that's fine. Yeah.
Okay. So I done the internship quite a few years ago, and I think it was probably slightly different when I done it then. But I thought I'd just give a bit of an overview about what I got from it and where I am now. So I was at the time registering as a clinical scientist when I heard about the internship, and as part of my role, I do diagnostic tests on patients who have problems of the visual pathway, and we can really localize where that problem is. As part of my training, I had to do a master's, and this was during the pandemic. So actually, what was going to be a clinical research study turned into a scoping review of the literature. It was still really useful, and it got me really interested in my subject area that I'm still working in now, which is inherited retinal diseases. But after I completed that, I knew I really wanted to have a more formal involvement in research. So in 2022 is when I applied and got the BRC internship. And at the same time, I was working with Dr. Laura Young at Newcastle University. And we were looking at funding opportunities and ways I could get some protected time out of my clinical role to be able to undertake this research. And Laura Young's research is focused on high resolution retinal imaging. And so when we look at the back of the eye, it looks a little bit like the red image, but when we apply this new technology, we are able to see these amazing pictures, which are individual cells at the back of the eye. And these are the cells that are diseased in the particular disorders that I'm interested in. So when I got that internship, I was able to have a day a week for 6 months where I was protected from my clinical work, and I was able to do some research. And it was really valuable. I was able to undertake quite a lot during that time. So I contributed to a literature review, which was published in a book chapter. I was able to get to know everyone who worked in the lab and get some new skills in the specific area that I was hoping to do my research in as well. And the network within the internship was really useful as well. So there was lots of other interns who I was doing this with, and we would meet regularly and sharing experiences in that way was really useful. There was also some really good mentors within my institution. So within NIHR, I was able to get some mentors who were provided to me by the internship, who also work in clinical science. So they were able to provide quite a lot of guidance as well. And during this time, I also knew that I wanted to stay on the research pathway. So I applied for more funding via NIHR. So I'd done the pre-doctoral clinical academic fellowship at the end of the internship as well. And so since then, I've been able to develop my research a little bit further. So I set up, well, for the PCAF, I thought I would set up a study, publish data, and apply for doctoral funding. But in actuality, what happened is that the ethical approval, which I think Roisin's just mentioned, took quite a substantial amount of time. It was slightly more complicated because of the technology that we're using, but I was able to get a good study setup ready for the next step. And I also was able to look at some data that we already had available, and I analysed it and presented it at an international conference as well, which was a really good experience for me. And the other thing that the internship got me involved in was PPI. So during my PCAF, I was able to do some PPI for my doctoral fellowship application, which I've been able to use since as well. And because I wasn't able to do the study, I then applied in 2024 for more funding. So I applied for the pre-op support fund. And for that, I was able to eventually complete this data collection, which I've talked about. So not that this is a little bit specific, but this is the type of image that you might see if you'll get your images taken if you've seen an optician or an eye doctor. And when we look at the back of the eye, we can actually apply this technology, and we're able to see these amazing pictures where we can see individual cells. We can quantify these pictures, and we can get huge amounts of information, which is really invaluable when we're diagnosing these conditions and also treating them. So I was able to publish this data, set up a lot of analysis techniques, and also put this all together to form a doctoral fellowship application. So the outputs from my specific internship were quite vast, I see. So I see it as a bit of a stepping stone into my start of my research career, and I really don't think I would have had the subsequent opportunities without doing this. So I was able to de-risk a lot of the things that are in my doctoral fellowship. I was able to get some publications. And another thing which I don't know if I've really mentioned was that I got a better understanding of the research community in my region and the infrastructure and support that's available to me around this area as well. And then also I've just submitted my doctoral fellowship application last week, and I do think the internship was really important in getting there. So in general, I think that my experience with research has been very positive. I'm really motivated to stay in research, but I do think there's some things that you might not consider. So I think you get lots of high-level training when you do research and really specialist skills. And I think that's been really invaluable to me. And also working with people in wider networks is really important as well. So going to conferences and meeting a lot of people in my specialism, and also having some sort of shared ground on research, I think is a really good way to get to know these people as well. I made these slides for a slightly different talk as well, but I have some links, which I don't even think I mentioned, but just if they are useful, I'll leave them on.
Thanks, Stephanie. So yeah, you're right. It's for me, an internship is that kind of like stepping stone, isn't that a building block? And it's a bit like a ladder to help you onto the research pathway in the very first place, because it can seem quite daunting. But actually, when you step on that, there's so much support around there. But then it really does help you to identify that. Stephanie, where did you go for your doctoral fellowship? Who have you applied for?
NIHR last week, and then I'm putting a welcome application in next week as well. So
all right, just yeah, I'm on that doctoral NIHR panel, so we'll see. I won't be able to do yours, but yeah. But you know, as a region, we've got loads of support and information. So it's just people at all different stages of their research careers, and I think that's why it's really lovely to have these opportunities. And this internship is purely there for students, and that's unusual. That this doesn't happen very often, and it's very unique that we'll be able to offer this to people, at this early on in your career stage. So thank you for sharing that, Stephanie. It's really, really great. Anybody got any questions? Anybody? India, May, Alfie, anything you wanted to ask so far? Nope. I must see we've just been so good about providing all the information that people need. Okay, but if you feel you want to put a question in the chat, then please do that. Can we just share the last couple of slides as well? Sean, if that's all right, go back to... Fab. So while I've got you, I just wanted to let you know of a couple of other opportunities that we've got coming up that's available. So as I said, as part of Insights, we also have fully funded master's opportunities. Next slide, please. So I just think I've got the dates on it. So this is to do with a master's in research. We have places open to study either full-time or part-time at Newcastle, Teesside, Northumbria or Cumbria. And I think there's masters in public health, research masters, clinical research masters, I said, are open available. You can find more information, I said, on the website, but just to let you know that applications for that were open on the 1st, or they'll be open on the 1st of February there. We've got a webinar coming up for that in February, you'll see, and then we'll close applications. Not only do we able to fully fund the fees for the masters, we're also able to offer stipends. So if you are studying full-time, you get a full-time stipend, which is about £20,000. If you are studying part-time, and you can also claim for a part-time stipend yourself if you're not working full-time, if you're working part-time or not, and again that's half the amount. So it's just a great way and a great opportunity. Insights, this is our third round of masters applications that we'll have, and it's the final ones that we're aware of. We're hoping that NIHR Academy will extend the Insights program further, but to date this is kind of potentially our last opportunity to offer fully funded masters research plus stipend opportunities for individuals. individuals. So please have a look at that. Obviously that's for people in their final year, so looking to be, or anybody within the first 5 years of graduation are eligible to apply for those funded opportunities. So that's our masters that's coming up. Yeah, the slides, happily share the slides. And as I said, we've also got something called the 4Ps Lite. Next slide. So the 4Ps is really based on person, place, project and plan. And when you do any kind of fellowship application or any kind of grant application, a lot of it is around the person, that's you, the place where you're studying in, what the support you've got around you, the project you've got, what your research is about, and also your plan, and that's to do with you as an individual, training, research, development. And those applications are kind of marked on around those 4Ps. I've been on numerous panels now with NIHR, both the pre-doctoral, the doctoral and postdoctoral, and all the applications really, we mark around those 4 criteria. So to understand that a little bit better and to get that starting to get terminology, we've got what we call the 4Ps Lite. Again, this is a fully funded place that's available. It's only a 3-hour course. It's an introduction to the research landscape and showcase really different opportunities that there are. So that's a really nice kind of like 3 hours, kind of really good introduction to the infrastructures that we've got within research, clinical research around the region, but also the national landscape too, and also to see what opportunities are available to you. So the next one I think it's going to be available in April, but they haven't quite confirmed the date yet. But there is you've got the details at the end of, just get in touch with the Insights normal email address or myself personally, and we can kind of forward those details on. But so that's a really nice introduction to what the 4Ps is all about, and what we look for, and just to kind of understand a bit more about research in general. So that's another opportunity that's available through the Insights programme. Yes, slides will be shared. Must an application be working full-time to be eligible? Just want to clarify that for me. What do you mean by working full-time? If you're able to either put your mic on or in the chat. What I would say is certainly for the master's opportunity, what we don't want people to be doing is working a full-time job as well as trying to study on top of it. And that's the whole idea about the NIHR Academy and these funding awards. Previously in the past, often many of us have done that. We've worked full-time and we've studied as well on top. But these opportunities are there to enable you to study, to reduce your working hours, on a temporary basis, and be given that study leave if you are working full time. This is the whole idea about you should be having conversations with your employer, saying that you're interested in applying, and having conversations about being supported to have that study leave. If you are working full time and you want to do the master's, for example, and you're going to study part time for the master's, then that stipend can go to your employer to cover some backfill, to cover your costs of your place. It's a set amount, so it's not kind of necessarily a direct cost changed, but it's there to support that. And in terms of the internship, we expect you to be a student while you're doing the internship program, not in full-time employment. Barry, you got your hand up.
Yeah, I was just going to come in, guys, and just mention that some of the providers are full-time courses and some of the providers are part-time courses. So one of the things you would consider when you're applying for a master's is what does the higher education institution offer? So from a Northumbria perspective, our master's is a part-time programme. So it would suit many people, but some of the other providers are full-time. So it's just to mention that really. And with the 65-hour completion, it's flexible. So my last 2 interns did their 65 hours over a 10-week period, but it had to be completed by the end of program. So they had to be within a student capacity prior to them completing. So again, it's like Annette says, do you have capacity to do a full-time internship? Are you working full-time or part-time? They're the kind of questions you could ask, but it suits everybody. So if you are working full-time or part-time, you can put your 65 hours around what you're doing. It might be that you take some leave to achieve those 65 hours, that you're being paid for it. And again, where you're going to, if you want to apply for the MSc program, think about, is it full-time, part-time, and how does it suit your lifestyle? There is a stipend, it can go to the employer or not. It all kind of wraps around you. But I think Stephanie's given a really good example of her experience that sounds incredible, and how it worked for her over a longer time frame. Whereas I know that some students would do it over a 3-week period. I've had students that done it over a 10-week period.
Thanks, Barry. And the opportunity to work hybrid or remotely, I think really that depends on your supervisor that you have. This is trying to get the most out of the opportunity. You've got those 65 hours. And because we are the North Cumbria, just because you're on one university doesn't mean to say that you can, be involved with the research team, anywhere within the region. This is what we're trying to do and trying to offer, being flexible. So you might want to go and, work in a clinical area, with the research. We can organise that kind of support and links in. That's what this is all about, is giving you those opportunities you might not have had otherwise. But if being able to do it remotely or hybrid, is suitable, and you've got your plan for your internship, what you're going to do, then we've got no restrictions on that at all. We're trying to be as flexible as we possibly can do, but to be able to get the most out of the opportunities that are on offer. Thanks, Emma, for putting those links in the chat as well. Okay, any more questions? Okay then, so thank you ever so much for coming. You get 20 minutes back of your life, you'll be pleased to hear. So again, we'll send round recordings and stuff, so that'll be up there, and the slides. But if you do have any further questions, if you think about it later on, then please don't hesitate to get in touch, and we look forward to seeing your applications. Take care, everyone.